All right, good evening, everyone, and thank you for joining us this evening for our chat about the COVID-19 vaccine and with the African American community. I am Sable Kay. I am the acting director of the Office of Health Equity and chair of our Health Equity Working Group. For the Virginia Emergency Support Team. We have an incredible group of panelists and folks for you, issue experts for us to share information with you, and also looking forward to hearing from you all what your needs are, what your concerns are, because this is a public-private partnership. We are truly here as state agencies to protect and to serve you all, and we can do that best if we understand and know your needs. So with that, we will begin with some housekeeping components, wanting to let everyone know that this meeting is being recorded. It's a public meeting that we'll be sharing with the individuals who have registered for this event, and that we want to know a little bit about who is in the room. So in lieu of a formal roll call, if you could introduce yourself via the chat box, share your name, your organization, the part of the Commonwealth that you're from. We would love to see who is here, and we're going to be engaging a lot both via the chat box as well as we'll have an opportunity for you to unmute yourself and provide public comment. So this is a great way for us to get to know each other and begin that engagement process. Also, we would love for you all to make sure that you all are engaging with us. So in the chat box as well, we're going to have several different issue experts available to answer your questions. So if you do have any questions there, we would like for you to avail yourself to the chat box while the individuals are speaking, and we are going to have ample amount of time for folks to engage with us both via the chat box, and we might give you an opportunity to verbalize your question as well. So with that, I also wanted to let you all know that we've made some accommodations for accessibility, and I'm going to step back here and allow, we have two wonderful Office of Health Equity members who are providing logistical support for our conversation this evening. We have Jasmine Smith, who is the Executive Administrator and for the Office of Health Equity, and we have Veronica Cosby, who coordinates our Partners in Prayer and Prevention program. So I'm going to step back and allow Veronica to talk with us through some of the accommodations that we've made this evening for accessibility. Veronica, are you there?
Yes, thank you, Sable Kay. Tonight for accessibility, we do have Virginia Relay Services remote conference captioning. The link has been provided by Don, who is actually our RCC captioner, in the chat box. If you are having also any technical problems, please feel free to send a message to Jasmine or myself, and we will actually put our information back into the chat box so you will have. Again, the RCC relay link is in the chat box. If you have any questions, please send myself or Jasmine a message via chat. Thank you, Sable Kay.
Thank you, Veronica. And just as an overview, I think it's really important to tell people a little bit about where we're going and the journey that we're going to take with each other over the next about hour and a half or so. So this is a community conversation in two parts. Part one is going to be the opportunity for you to hear from our incredible leaders here in the Commonwealth about the great work that has been done over the past several weeks and months to prepare the Commonwealth for the vaccine, and also to make sure that we are using a data-driven equity approach to ensure that the vaccine is going where it needs to go, meeting the needs of those who need it the most. So that is going to be part one of our conversation. In just a few moments, you're going to have an opportunity to hear from Dr. Janice Underwood, our Chief Diversity, Equity, and Inclusion Officer here in the Commonwealth of Virginia, and she's going to be introducing our governor, Ralph S. Northam, who is here. Thank you so much for joining us, Governor, to provide remarks for this community conversation as well. And from there, you're going to hear from our state coordinator from the Virginia Department of Emergency Management, Curtis Brown. And then to round up our Unified Command leadership, you're going to hear from Dr. Norman Oliver, who is the State Health Commissioner at the Virginia Department of Health. From there, you will hear from our vaccine unit designee, who will give you an overview in terms of what we're doing here in the Commonwealth, and we'll also have a brief communications overview. So that's going to be about 20 minutes or so of us talking and explaining all the different resources and information that we have available. And after that, we are going to open up the floor and we're going to read through the questions that hopefully you all will be putting in the chat throughout the conversation, and we'll be able to answer as many of those questions both in the chat and orally as we can. The second half of our conversation is going to be a listening session. We think that I come from a background in HIV, infectious disease, and contact tracing related work and policy work. And there's this concept called MIPA, where in the community that I'm from, and it's called Meaningful Inclusion of People with AIDS. And it's been integral to all of the community engagement work that I do in my current role as Acting Director of Office of Health Equity, is that anything that is done for community needs to be done with the involvement and engagement of the intended community that we're hoping to serve, which is why we are hosting this session tonight, and which is why we have 45 minutes or so designated to hear from you. So after we hear from Galen Knoyton, who is our co-chair for our communications and messaging sub-work group, we are going to allow public comments from as many folks who are on the line as we can accommodate, so that we can, every person will have 1 minute to speak and to tell us about what they're excited about, why they may be reluctant or hesitant to take the vaccine, what questions they have, what concerns they have. This is really an opportunity for us to do, as my grandmother would say, listen and observe twice as often as we speak, and really hear from the community. So we are hoping that you all will engage us at that time. So that's an overview of what we have planned for this evening. And with that, I'm going to turn things over to Dr. Janice Underwood, who's going to chat with us a little bit about who she is, the great work that she's doing, and introducing our governor. We are super excited to have her here to speak. She is the leader of our Health Equity Leadership Task Force, which is doing some really incredible work across the Commonwealth. So Dr. Underwood, are you there?
I am. Give me a thumbs up if you can hear me. Excellent. I like audience participation. I'm a K-12 teacher at heart. So good evening, and thank you, Sable K, for that kind introduction. She is certainly one of the accomplices that unapologetically thread health equity into this recovery and response. Shout out to all the Health Equity Working Group members out there, and to all of our faith leaders and community leaders who have joined us. My name is Janice Underwood, and I am so pleased to be with you this evening to discuss the COVID-19 vaccine, the hope at the end of this long tunnel. But my primary charge is to really promote inclusion. So I'm here this evening to turn your feedback and suggestions into concrete equity policy. In fact, I have a statutory obligation to do so. So check out the Virginia Code. It says that that's what I'm supposed to do. But we know there are so many questions out there. Some we have answers to and some we don't. For instance, we know that the vaccine is 95% effective on adults, but there is not data available for young children or pregnant mothers. So I'm simply here to listen, and to the extent when I can, answer your questions. It is the top priority of the Governor's Office of Diversity, Equity, and Inclusion, and many of my team members are on the line today. So high five to you all who are on the line representing my office. But we're here to better understand your equity concerns, particularly the issues of access and trust, which we know have been a topic of conversation with a lot of the things that we've been dealing with, whether it be the test itself, COVID-wise, and now the vaccine. But like I said, the content experts we've assembled this evening, and others in the coming weeks, we have a lot of really exciting webinars and events planned for you, We're all here to answer everyone's questions because this information is for everyone. So if you're joining tonight as a member of the African American community or possibly an ally to this community, or you represent another community, we want you to know that we care about you, and there's a dedicated team working to make sure that all of your questions are answered and you have the best information to make a decision about the vaccine for you and your family. The Equity Leadership Team, the Health Equity Working Group, the Vaccine Working Group, all of us here assembled are really making sure equity is our top priority. And why? Our why is that the virus has exposed long-standing systemic health and social inequities experienced by those in the Black community and Latino community. For example, we know that while the Latino community have the highest rates of positive COVID cases, the Black community is burdened with the highest death rates. And these disparate outcomes are even more significantly exacerbated for the LGBTQIA+ people of color and communities. With so much disparity across all communities, including people with disabilities and those in rural communities and those in low-income communities, we must build trust and ensure equitable access to the COVID-19 vaccine for everyone. These are very important and difficult conversations, and we are committed to having them, which is why Sable K, Nelson Dyer, and the entire Health Equity Working Group has created these town hall conversations in collaboration with the COVID-19 Vaccine Working Group. So whether you're an urban, rural, suburban, veteran, civilian, the faith community, the Native American community, Black or white communities, we all need to be having these conversations. We are one Virginia strong. We are many Virginians, but one Commonwealth strong. So I look forward to the conversation tonight and others in the coming weeks and months. I will be listening intently, taking notes, reading the chat box, and taking information that I learned back to our team to think deeply about the issues raised tonight. I'd like to close by saying hope and 2 different vaccines are on the way. But there are several factors we need all Virginians to keep in mind, like we must continue to wear a mask and wash our hands and keep our distance from each other, even after taking the vaccine. Also, what we know for sure is that we will have to take 2 doses of the same vaccine. This is not a live vaccine. There is no out-of-pocket cost to any of our residents, including for our undocumented immigrants. So in the meantime, stay home if and when you can, and we must support each other with facts. Please only get your information from trusted public health sources like the CDC, your care provider, our own Virginia Department of Health, the governor's office, or the Virginia Department of Emergency Management. I say this because there are already a lot of vaccine scams going on, and they're targeting the Black and Latino communities in particular. So please be on guard, because there are folks out there that will attempt to use this moment for their personal gain. But thank you all for the sacrifices you've made to get us to this moment. Together, we will get through this like we've done time and time again. Well, now I'd like to just turn and share with you that I have the distinct honor to introduce our next speaker. Governor Northam is someone who is walking the talk. We are so fortunate that he brings to this work his experience as a former Army doctor, a pediatric neurologist, a business owner, a state senator, and former lieutenant governor. Governor Ralph Northam, the 73rd governor of Virginia, has a heart for all people, especially those who have been historically marginalized and underrepresented. And it is this deep love for all Virginians in particular that guides every decision he makes. It is my honor to welcome my boss, the 73rd governor, Governor Ralph Northam.
Hey, good evening to everyone. And Janice, Dr. Underwood, you are my boss, so we need to get that straight right up front. But thank you for your words and your leadership. And, you know, I just appreciate everything that you do for the Commonwealth with diversity and inclusion. And as we're talking about tonight, equity for all Virginians. So you stay healthy and keep up the great work. But I appreciate introduction. I want to just take a second to thank some other folks. Our Commissioner of Health, Dr. Norm Oliver, is with us tonight. A wealth of information. He has been working on this pandemic night and day and weekend since March, maybe even before March. Believe it or not, 10 months now. Our first case was on March 7th. So I just want all of you to know how hard he has worked. Our Secretary of Health, Dr. Carey, and his staff have worked nonstop to keep Virginians safe and get us through this pandemic. You're going to hear from Curtis Bryan, who is with our Department of Emergency Management. Very important work that he is doing through his leadership. And then we have the Vaccination Advisory Committee. And I know that my friend Gayleen Connaughton is with us tonight. Wendy Klein may be on here, I'm not sure, but there are a whole lot of people working either on the scene or behind the scenes to really make sure that we do this right in Virginia and do everything that we can to put this health crisis behind us and get back to what we know as our near normal lives. Most importantly, though, tonight, I wanted to come on and thank all of you that are either listening, watching, or both. It is just so important that we provide accurate and updated information. We believe in science, we believe in being factual, and we want you to know that. But most importantly, tonight, we want to hear from you because we need to hear your concerns and really learn about that and then move forward and be able to help people throughout Virginia. So I know there are a lot of things y'all could be doing tonight, but I just thank you on behalf of the Commonwealth for being part of this. I'm going to be brief. Janice actually covered a lot of what I need to communicate. And also I meant to thank Sable. Sable, I know we've been on a number of these, and thank you so much for your kindness and your leadership and just being so pleasant. I really appreciate that. So we have a great team, and that's what makes me proud to be governor of Virginia. I want to talk about some concerning things to me and then some exciting things to me. And first I'll talk about the concerning things. Today, we had over 3,000 new cases. We reported 56 additional deaths. Every death is one too many. Our positivity rate has been going up. So my message to you tonight is, while there is excitement on the horizon, as Janice said, while there is hope, which we all believe in hope, we need to continue to follow the guidelines, and we need to continue to tell our friends and neighbors to follow the guidelines. We still have several months where this virus is going to be with us. It is alive and well. It is dangerous. It is contagious. And we need to do everything that we can to keep that curve flat for all of us, but especially our frontline workers, our essential workers, our healthcare providers, nurses, staff. These folks have been fighting this now for 10 months and they're tired. And I understand that. So we all need to be part of the solution, as I say, and be responsible for helping one another. So thank you all for that. The exciting thing is the vaccination is here, and the smartest, best scientists in the world have been working on this for months, and the FDA has been following the data. We have been following the data. Yesterday, I was at a hospital in Richmond to welcome the shipment of the doses of the vaccination. And then today, I was in my area of Virginia before I became governor, 757, as I like to call it, at a hospital where actually I witnessed one of the first injections. And I was there to thank the healthcare team and also those individuals that had stepped forward and said, I realize this vaccination is safe, it's effective, and I want to be right at the front of the line and take it. And so I commend the individuals that participated in that today. There's no question that as we deploy and distribute this vaccination, there are challenges. And one of the reasons we're doing this talk tonight is to provide accurate information about the vaccination and to hopefully together build trust that it is safe. And And if we can do this, and I credit Dr. Oliver and his team from the Virginia Department of Health, they have a very organized approach. There are different phases. There are actually different sub phases, and we're starting with the frontline, the healthcare providers that take care of the sick every day. We also want to include in that first group our long-term care facilities, both the staff and the residents. And then we'll, as we get better supply, and we expect that, then we'll branch out and hopefully by early to midsummer, everybody in Virginia will have had access to the vaccination. And as I said at the beginning of my comments, finally, we can put this pandemic behind us and get back to our normal life. So thank you very much for being with us tonight. We are biased, but we believe we live in the best state, in the best country in the world. And I'm so proud of Virginians for all that they've done to help us get through this pandemic. And finally, as Dr. Underwood said, we see hope, we see light at the end of a very long and dark tunnel. And so we're pleased about that. But in the meantime, please, for all of you, I want you to have a safe and peaceful holiday season. Take care of yourselves, take care of your families, take care of your loved ones and friends, and just stay healthy and safe. And 2021 is going to be a better year. So thank you, Janice. Thank you for your kind introduction. And I believe Curtis Bryant is going to be next from our Department of Emergency Management. So Curtis, thank you for your leadership and welcome.
Thank you, Governor, and thank you for your leadership and support. And good evening to everyone. Glad to join this conversation and listen in on what the questions are, and to share a little bit about what we're doing as we move forward with this unprecedented response. I'm Curtis Brown. I'm the State Coordinator for Emergency Management at the Virginia Department of Emergency Management. We work under the direction of the Governor to facilitate the process, to coordinate all of our state agencies, to leverage all of the resources of state government to respond to disasters and provide support to local governments and residents. We call this the Virginia Emergency Support Team, or the VEST. During this unprecedented pandemic, we facilitated the logistics of critical personal protective equipment, testing supplies, and other key resources across the Commonwealth to our healthcare centers, long-term healthcare clinics, and to our local communities. We've actually had a very successful program called our Health Equity Pilot Project that has provided resources of masks and hand sanitizer directly to individuals in the community that are most at risk and in need. A lot of our communities of color across the Commonwealth. At the core of our response, since the very beginning, we've embedded health equity as a primary focus of our response. We wanted to take proactive efforts to mitigate the disproportionate impact of this disaster on Black, Indigenous, and people of color across the Commonwealth. I know many of you all have been affected just as we have been, our families and friends as well. And so the Health Equity Task Force has been critical to providing me and Dr. Oliver with ongoing advice and insight on how to equitably allocate resources, ensure that we are inclusive in our messaging in all of our key decisions throughout the course of this disaster. We understand the critical importance of community involvement, and that's why we really value the Health Equity Working Group, which is a component of the task force that constantly provides insight, again, on messaging and outreach efforts and how we can improve our response. As we move forward through this extended response, we'll continue to do that. We'll continue to answer questions, promote transparency, and provide vital information. So I really appreciate everyone's time and attention and participating in this meeting. And as the governor said, we're looking forward to what 2020 might provide, but right now this is still a very critical and serious part of our response. And so please stay safe, especially over this next couple of weeks. Wear masks, social distance, sanitation, and hand washing, are going to be very key to mitigate the further loss of life as we move forward. And for some folks across the Commonwealth, we do have winter weather coming in. So if you do have to venture out, please stay safe as well. Thank you very much, Sable K, and I look forward to continuing to listen in and participating in the rest of the session tonight.
Thank you, Director Brown. Thank you, Governor Northam. Thank you, Dr. Underwood, for your introductory remarks. And thank you also to all of you all who have joined us. And we will now turn things over to our State Health Commissioner, Dr. Norm Oliver, to provide a health equity update. Dr. Oliver, are you there?
Yes, I am. Finally found the mute button. Is my audio coming in okay?
I think so.
Okay, great. First of all, I want to thank everyone for attending this event tonight. It's very important that we get out as much of the factual information as we can about the exciting development of these vaccines as broadly as we can in the African American community. So I really appreciate your attendance. As has been mentioned by both Drs. Underwood and Governor Northam, we face a severe health crisis in the Commonwealth and across the country. You all are well aware of it because the African American community has been particularly hard hit by this pandemic. As Dr. Underwood mentioned, the highest rates of mortality are being experienced in the African American community, which is bearing a huge, huge burden from COVID-19. Also, even in the incidence of the disease, that has been particularly high and disproportionately high in the African American community. Currently, we are experiencing another surge in cases in COVID-19. The number of cases per day, as Dr. Northam mentioned, is now between about 3,000 and 4,000. And that's been the case for well over a week. And we've been seeing the rise for well over a month. The number of cases that we are seeing every day right now is about 3 times what we were seeing back in April and May of this year. This just underscores the importance of us taking the kinds of personal actions that we know work to help stamp down and tamp down the spread of this disease. Wearing our masks, washing our hands, and watching our distance from each other. These things can help prevent the spread of the disease, and we need to do that now, and we will need to continue doing that for many months, even as we are deploying the vaccine, which is so effective against preventing you from getting COVID-19. Until the majority of Virginians have been vaccinated and we've achieved a situation where the virus cannot infect any significant number of people, only at that point will it be safe to stop some of these other personal behaviors that we know protect ourselves from the disease. Back when the virus was running rampant in China, and we knew that it was now a pandemic, many of our leaders, medical leaders, including Dr. Fauci, were looking toward the possibility of developing a vaccine. You may recall that Dr. Fauci said that he thought a vaccine would be developed within 12 to 18 months. And here we are now, approaching about 12 months after he said that, and we have 2 vaccines that are ready to go. One that has been approved by the FDA and has actually arrived here in the Commonwealth yesterday and today, and we'll get into that in more detail in just a moment. Some people thought that that development happened really too fast. That isn't really the case. The vaccines are different now. I think it's really important to recognize that the science of vaccines has changed a lot over the years since we've last produced some vaccines in this country. And these vaccines, which utilize something called messenger RNA, are a result of this advanced technology. We knew the genetic makeup of the virus back in January. We were provided that information by the Chinese. As soon as we knew that genetic makeup, we were able to generate the messenger RNA from that virus in a matter of days, and then spent the last 11 months or so developing the vaccine with that messenger RNA, and then testing it in phase 1 trials to see whether or not it was safe to take, phase 2 trials to see whether or not it was effective, phase 3 trials in which we tested both the safety and efficacy of the vaccine in a broad layer of people. Between the Pfizer and the Moderna vaccines, some 70,000 plus people participated in these clinical trials, including a number of African Americans, so that we knew that it, in terms of adults, it was effective in a broad range of the population. And it was 95% effective for both of those vaccines. And the 5% who got the disease only got mild disease, which means that it's 100% effective in protecting you from the serious disease that some people have had, leading to serious morbidity or even death. It went through these clinical trials, a thorough review by the FDA, review by the Advisory Committee on Immunization Practices, and only after that was it actually approved. We've had our own sort of third check on it ourselves here in the Commonwealth with our Vaccine Advisory Committee, which is part of the VEST that Coordinator Brown just mentioned. This is a broad group of stakeholders, faith leaders, community-based organizations, medical scientists, ethicists, health equity experts, and they too had a chance to take a look at the evidence and decide whether or not this vaccine is safe and effective. Their recommendations on how we should distribute the vaccine are aimed at ensuring that we distribute it in an equitable fashion. And we are doing so, and we will do so in the most transparent way possible. As Governor Northam mentioned, we will be doing the distribution in a phased way. Those of you who've been prior to COVID-19 on an airplane have heard the flight attendant talk about how when if you need oxygen and the oxygen mask drops down, be sure to put it on yourself first before helping others. We're doing the equivalent of that for society as a whole by vaccinating our healthcare workers first. We know that if we are sick, we want those people there able to take care of us. And so we want to vaccinate them first. If you are a fan of social media, get on TikTok, get on Snapchat, get on whatever your favorite social media is, and look at what's happening right now, where you can see healthcare workers dancing in the hallways as this vaccine is arriving for them. They've been on the front line taking care of people with COVID-19 now for 10 months with the protection of personal protective equipment, but many of them have gotten sick. There's been a significant number of them who've fallen ill because of COVID-19, and now getting this vaccine will enable them to continue their passion for taking care of us without having that fear that they're going to get this dreaded disease. We will take care in the first wave of the vaccines of healthcare workers and residents of long-term care facilities, skilled nursing facilities, and assisted living facilities. We call that phase 1A. In phase 1B, we will begin vaccinating essential workers, people who are part of the critical workforce, the people who keep us fed, who help us with much needed transportation and other essential industries and the workers within them. I think it's important from an equity point of view to realize that one of the reasons why Black and Brown people have been disproportionately affected by this disease is because we comprise a large number of people in these essential industries. So when we say that we're going to move toward vaccinating essential workers, I think it's also important to realize that through that means we will also be getting to a large segment of the African American, Latinx, and other communities of color. In phase 1C, still part of the whole first phase of the vaccination campaign, we will then move to adults 65 and older and adults with underlying medical conditions that put them at high risk for getting bad outcomes from COVID-19. Once again, because of the inequitable and discriminatory way in which healthcare service delivery and the social economic conditions in which our communities are subjected to, because of those things, chronic disease is much more prevalent in our communities. This is yet another example, I think, of on this side of things with the vaccine, we will be reaching out to and being able to vaccinate a large number of people in the African American community. Just think of our own families and all the people who would fit into these categories, and you'll understand why I would say that. Phase 2 and 3, we move into broader populations, more widely into the African American and Latinx communities and other communities of color, and then into the general public. As Governor Northam mentioned, we think that as the pharmaceutical companies ramp up their production of the vaccine, that we will have enough vaccine to vaccinate the general public by next summer and reach a situation in which the majority of people will have the vaccine, and as a result will be able to reduce the pool of people who can possibly be infected. And that's where you hear this term about herd immunity. If we're all immune, then the virus has nobody to infect, and we can put an end to this pandemic. I'm going to leave it at that for now. I think it will be important to hear from our vaccine unit, and Dr. Whewell will be able to give you some more specifics about what we're doing right now in Virginia around this campaign. I want to thank Dr. Whewell and all the other members of our vaccine unit for their outstanding work. We've been preparing for this for months, planning for it, testing ourselves on different scenarios, doing exercises to get ready for this work, and we are ready. And this is going to be a very important campaign, obviously, for the Commonwealth and all of its residents. And I want to assure you that this team that we have that's leading this campaign is excellent and will be able to pull it off. And with that, I'll hand it back to, should I hand it back to you, Sable K, to introduce Dr. Whewell?
Absolutely. Thank you so much, Dr. Oliver, for those poignant and very timely remarks. And I have the pleasure of introducing Dr. Whewell, who will be giving us an overview. And Dr. Whewell, I know that you are going to be talking to us big picture about all of the great work that our vaccine unit here in the Commonwealth of Virginia has done to prepare for the vaccine. But if you could, there are a couple of questions that have been taking some particular notice. One of those questions, folks are really concerned about cost. So if you could, in your introductory remarks, discuss some of the cost concerns that exist in terms of, and also how VDH is going to address some of those pieces. And also, people are worried about side effects. What are the safety and efficacy measures that we have here in the Commonwealth to protect the residents of Virginia? Dr. Weevil, are you there?
I'm here. Thank you, Sable. And I've been taking some notes from the chat, so I'm happy to talk through some of the more specific questions. So thank you for having me. And I'll just briefly go over a little bit of what we've been doing to plan, and then happy to get into some of these very, very good questions. So first, I want to just emphasize, as all of the remarks have been made, that your safety is our top priority. As Dr. Oliver said, there's no shortcuts that have been taken in getting this COVID vaccine to Virginians. And as one of the questions that came up is, how are we going to be able to ensure the safety and specifically the tracking? And I want to just say that there are many mechanisms in which the CDC is using to be able to, first of all, these studies that have the clinical trials that have been going on, and it's as Dr. Oliver talked about, it's kind of this process in which the federal government helped support these manufacturers, and there was some financial risk there in the sense that there was manufacturing that was happening at the same time as the clinical trials. That's typically not what happens. Typically, they do the clinical trials and then start the manufacturing. But by doing that, it allowed the process to speed up. And they've had these huge, robust phase 3 trials, which they've tried to build it out to ensure that there's a diverse population. And so they've provided data from these trials, but they will continue to track and monitor any sort of side effects that are occurring. So there's a few different ways. One in which they will use a system called VAERS, or Vaccine Adverse Event system, as well as VSafe, where those people who receive the vaccine can provide daily updates to their symptoms or any how they're feeling, so that they can track the safety. As far as specific side effects, some of the ones that have been noted as the most uncommon is pain at the injection site, pain or redness. Some people have had a fever. It's typically they're very short-lived side effects, and then within 24 hours or so dissipated. And then some headache. Those are some of the most common side effects. The cost, the vaccine will be 100% free. Dr. Underwood talked about that. Those who are administering the vaccine may be able to bill insurance for the administration fee. However, there will be no out-of-pocket cost and for anyone. So if they do not have the ability to bill insurance, then HHS has set up a fund in which the federal government will reimburse, but there is no out-of-cost pocket, and there is no cost sharing for anyone who receives this vaccine. To talk a little bit about the side effects, let me just briefly talk a little bit about how these vaccines work. So the two vaccines that are currently being discussed, one is the Pfizer vaccine, which has, I'm happy to report, has been distributed to healthcare facilities as of today. There were some that were received yesterday, as well as more that were received to other healthcare facilities today. The other one, Moderna, is a vaccine that's manufactured by Moderna, and the FDA will be meeting later this week to review the safety and clinical data from that manufacturer. Both of these vaccines are mRNA vaccines, mRNA is a nucleic acid, a protein, and what it does is it enables the body to protect itself from COVID, so that it actually allows the body to recognize COVID. It attaches to the cell. It never actually enters the cell, but by that protein attaching to the cell, and then it safely gives the body the ability to recognize the virus and then create this strong immune response to fight off the virus. The vaccine doesn't contain the virus, and then the protein is rapidly broken down in the body and leaves the body. And then I think there was a question about the ingredients. So the vaccine itself there's not any preservative in either one of these vaccines. It is the mRNA, the protein, and then it has this lipid particle outside, and there's a few different ingredients within that lipid nanoparticle that is protecting that mRNA vaccine. And those are the ingredients. They will release those ingredients. And as far as adverse events and whether or not, if there is an allergic reaction, then first of all, those that are administering it would be highly trained and be able to handle that. But what they're seeing in the safety profiles is those that have had adverse events are those that have had anaphylactic shock, potentially to other vaccinated medications. So not typically those who have just that have allergic reactions to food or insects or other allergies. Someone asked about how this vaccine, that it's 2 doses, and that is true. Both the Pfizer and Moderna are 2 doses. And then what the protection or immunity is after the first dose. And with Pfizer, and Dr. Underwood and Governor Northern certainly, and Dr. Oliver indicated that, it's very important to remember that they are 2 doses and that you would need to receive both of those. Studies have shown that there is some immunity from the first dose. It's approximately 50%. And then that second dose is where it gets you up to 95% immunity. Questions about if you've had COVID and whether or not you can get the vaccine, and the answer is yes. However, most people after they've had COVID, the immune response is high enough, and so that you would not be likely to contract COVID within the first 3 months. So the CDC has recommended that you not get the vaccine within the first 3 months because you would already have the antibodies to fight the virus. Eligibility, everyone will eventually have access, as Dr. Oliver talked about, and the different phases. And we are working in ways to ensure that, first of all, this vaccine is provided based on both safe and in an equitable fashion. And just want to highlight that at the beginning, we are going to have less allocation, but that's going to increase as we go further. Sable, I'm happy to stay on and answer questions. I don't want to use up all the time to just talk through it, but I'm happy to keep answering questions as they come up.
Absolutely, and thank you so much, Dr. Whewell. We have a dream team in the chat box right now. We have Dr. Oliver and also Dr. Lori Furlano, who is our Deputy Commissioner for Population Health. She's going to be addressing some of the questions that is in the chat box along with Dr. Oliver, and I know that some of those questions have been answered already, so thank you all for providing these real-time insights. It seems like we're getting some good feedback and good questions in the chat. But I'm going to try to thematically group, Dr. Whewell, some of the questions that I've seen in the chat for you to address next. People are concerned in particular about allergic reactions and about whether or not there have been a lot of questions about to what proportion has the African American community been included in the sample size for the Pfizer vaccine and other vaccines whose EUAs may be forthcoming. How will people know that it's safe for folks who look like them to take?
Sure. So, so as I mentioned, the clinical trials have included a fairly diverse population. They certainly have provided some updated or some information on the different populations in which were included in the clinical trials. And I've not seen any data that shows that there's been more adverse events in certain populations. Dr. Oliver, do you have anything to add to that?
No, I have nothing to add. That is true. There's no evidence. There was, it's like many clinical trials, the trials for these vaccines had only a minority of participants who were people of color, but it was a large enough group of them that we can say with confidence that, for example, the vaccines are safe for adult African Americans. Someone asked whether people, Blacks with underlying conditions were in the trials, and the answer is no. In fact, people with underlying conditions were, of any race or ethnicity were not included in these trials. So.
Thank you for that clarification, Dr. Oliver, and also thank you to Dr. Fulano for answering questions. She's providing, I'm hoping for those of you all who are able to join us via chat, both Dr. Oliver, our State Health Commissioner, and Dr. Fulano are answering questions as best as they can through the chat, and there are lots of really great resources that are being shared. Just as a point of follow-up, another question that we have received is whether or not people will receive a recording of this presentation. We are going to be sending it out to every individual who has registered for our conversation tonight. So you all will be receiving the PowerPoint slides and also the recording for tonight's conversation for you all to use in some of your community engagement events to the extent that that would be helpful.
Hey, Sable,
So,
sorry,
ahead,
I can add one thing. As Dr. Fulano mentioned, in addition to VAERS, the vSafe is the smartphone based tool that'll provide the check-ins for people after they've received the COVID vaccine, and Dr. Fulano provided the CDC information. I want to just draw back to a comment that was made, is that, you know, certainly as we continue along this journey, we want to make sure that the information that is available, first of all, that there's transparency, and secondly, that that you're receiving it from trusted sources. And I want to highlight our vaccine website. So if you go to www.vdh.virginia.gov, then you'll see that there is a button right there on there that says for vaccine information, and we are making sure that we have that information there. So for example, vSafe and a fact sheet for that information is there, and as well as many other tools. So we certainly want to point you in that direction. We're trying to certainly utilize information from the CDC and reputable information and trusted information to be able to provide back to the general public and healthcare providers.
Thank you, Dr. Whewell. I'm seeing that there are additional questions as it relates to being able to document. We know that there are going to be multiple types, just like trying to thematically group a lot of what I've seen. We know that there are going to be multiple types of vaccine. Pfizer is currently has EUA approval. Moderna is up next, and we know that some other companies are going to be coming down the pike, Johnson & Johnson, for example. So if you could kind of walk through some of the safeguards that we are preparing as a public health, working in collaboration with our private healthcare systems, how we're going to track who is getting what vaccine and those kind of timeline pieces, and how we're going to also leverage information to the extent that we can, who's getting the vaccine in terms of the demographic breakdown.
Sure. So, so the vaccine, as you receive the vaccine, then there will be very limited, but information that will be collected. Of course, it's certainly up to the individuals, but it helps for us to get the information to know, for certain populations, who's receiving the vaccine and so on. But from there, then it'll go in to our Virginia Immunization Information System, which is our vaccine registry. We have signed a data sharing agreement with the CDC where we provide very limited de-identified information over to the CDC, and then, but also within the Virginia registry, that allows us to be able to document what vaccine you've received, and track it. And so then therefore that will be there. And when it's time for the second dose, or, then you'll actually know which vaccine. In addition, when you receive the first vaccine, the first dose of the vaccine, you'll receive a vaccine reporting card, which will have that information for your documentation as well. But that is a mechanism in which we'll use, because as we know right now, the information is that these vaccines are not interchangeable. So it would be really important that you receive the same product or the same manufacturer's the vaccine for the second dose.
Thank you. Thank you so much. I know that we have a lot of questions that are in the queue, in the chat. Please know that we will continue to have Dr. Whewell, Dr. Oliver, and Dr. Furlano registering these questions and trying to answer as many of them as they can in the chat box. But also this information is being solicited so that we can make sure that we have proper information and ample responses in our public health information that is available on our VDH website. If you all go to the website that's listed here on your screen, vdh.virginia.gov/COVID-19 vaccine, we have a FAQ document that has been uploaded there, and that is going to be an iterative document, and we are going to be continuing to ensure that we are addressing the needs and the questions that you all have. So to the extent that you all have questions that aren't addressed in our current FAQs, we will be able to get them added to our updated version of the FAQs. So please be on the lookout for that. But with that, I just want to be cognizant of our time. I just want to thank you all for taking the opportunity to ask your questions and to learn and to engage with us in the way that you have. But I also want to honor the space that we have for the opportunity for us to hear from you. So with that, I want to turn things over to Gaylene Conoyton. She is the president of Celebrate Healthcare LLC. She is a member of our Virginia African American Advisory Board, and she's also co-chair of our Virginia Advisory Work Group Sub-Communications and Messaging Sub-Work Group. And I just want to give her a couple of moments to chat about why it's so important for the Black and African American community to relay their thoughts, and then we'll shortly be opening up the floor to you all for public comments. But in the meantime, Gaylene, are you there? Gaylene?
Thank you. I was waiting for them. I was on a control mute, so I couldn't unmute myself. Thank you, Sable K, and thank you for everything that you're doing, and your team are doing an excellent job with these community conversations. And I want to welcome everyone and thank you for being on this important community conversation listening session. You know, just like you, when the COVID first hit, we thought it was going to go away, and it's still here 10 months later. And it's so important that we hear from you. Like many of you, you lost a loved one behind COVID, and I lost my mother behind COVID. And she was in a nursing home, and she came down with pneumonia. And then she tested false negative twice for COVID, so we didn't think she had COVID. And then she had a heart attack and a seizure, and then went on a ventilator, and we thought she was gone then. And then she came out of it and said she was ready to go home. And we thought she had bounced back. And when she went back to the nursing home, she never bounced back. This is such a sinister disease that even after you get over it, it still can attack your organs. It still can be working to attack your organs. And that's what it did. It made her not want to get out of bed, not want to eat, not doing anything. And so then finally she passed in June. And so this is why I'm dedicated to working so hard, because I don't want anyone to have to go through what I went through, you know, behind my mother between May and June. It is important that we know the facts. I perused through the names that's on this Zoom right now, and all of you are leaders, whether you're leaders in the faith community, you have a business, your organization, your family, you know, or a project. You are all leaders. You are all trusted leaders. And so it's important that we have the facts, you know the facts. You visit the BDH website on a regular basis, keep up with the FAQ sheets so that you can educate the community and educate your peers on what this vaccine is all about. We are in historic times right now, and everyone has a role to play. And when we look back on this years from now, you should be able to say, what have you done to help be a role in this pandemic to make sure that it goes away and make sure that we educate the community. We need everyone at the table. And we don't want to politicize this. We want to just deal with the facts. And as everyone says, it's important to wear your mask, wash your hands, social distance. And I always add one more, open a window. Ventilation is key. Ventilation is so key, you know, to this pandemic. And we are here now with the vaccine and need as many people as possible to be educated on this and take the vaccine. As we know historically that African Americans have disparities with their healthcare. We know that with our healthcare. We know that they haven't been kind to us at all with the disparities. But you know, this is new technology. And that's something we need to know. Just like the flu shot. Many of you all said, I'm not going to take the flu because the last time I took it, I took the flu, it made me sick. Well, you know, back years ago, it was a live virus. The flu shot is not a live virus anymore. Just like this vaccine is not a live virus. And so this is the kind of information that we're going to need you to come back with, take back to your community, you know, about what this vaccine is made of, what it does. And look, it's going to be transparent. We're going to be transparent about it. We are so fortunate to have a governor that's a doctor. And all doctors have to take a code of honor. They have to take a code to say that their patients come first. And so we are fortunate to have a governor that's a doctor first. It's like he took an oath to have governor, being a doctor is first. And so we are very fortunate for that. And I just want to leave you with this before we open it up to hear your comments. You have so many people working on your behalf in the Commonwealth and in the country. I can't tell you how many people are working. So many people are at the table to work really fast to make sure that the information get out there, to make sure the distribution is equitable, and we need you. And so we have people like you that are at the table too, and we need more people. So I just want to thank you so much, you know, for being here. We'll be doing more of these listening sessions. We need to have these listening sessions so we can develop the messaging to make sure that we are reaching the people that we need to reach. So with that, I'm gonna turn it back over to Sable K, and we want to listen to hear what you have to say. Thank you.
Absolutely. And thank you so much, Gayleen, for sharing your story. There are several people who are reaching out via the chat, both to me privately and then in the public chat as well, who have also unfortunately had the situation where they have lost a loved one to COVID. So thank you for being transparent about that. And thank you for those of you all who are sharing your personal experiences as well. And with that being said, we want to open up the floor to hear from you. That is primarily the reason why we wanted to have this conversation tonight. And we want to make sure that to the extent that we can, we want to have as many people be recognized to provide public comments. So this isn't going to be an opportunity for us to respond to you, but more so for us to hear from several people in succession in terms of what their concerns are, any concerns that they have, any fears, reluctance, or even if they're like excited. We just want to hear from you in terms of what you think the governor's office should know, what you believe that the Virginia Department of Health, the Virginia Department of Emergency Management, what we should know as we move to disseminate this vaccine into community and to the residents across the Commonwealth. So each person, if you could, if you have an interest in providing a comment, if you could raise your hand via in the Zoom platform to the extent that you have that ability. If not, if you could just type in the chat, I'm so-and-so and I would like to make a comment. I will be monitoring both the participant list for hands raised as well as the comment list to see if there are folks who want to make a public comment. You will have 60 seconds to make that comment. I will be marking the time with my telephone. When you all hear the chime, if you could wrap up your comments in about 10 seconds or so, then we'll move on to the next person who wants to make a public comment. But I just, again, want to thank you all for your joining us this evening and also wanting to raise provide the opportunity for folks who you can continue to put your questions in the chat, but I'm also wanting to make sure that we provide public comment time. The first person I see is Brian Brown. Brian, are you there for a public comment?
Yes, I am. I'll be extremely brief. Thank you I can't find enough words to say thank you for this. This is beyond outstanding. This team that you put together is beyond a dream team. It's almost, if I can be a little bit religious, a gift from God. So thank you so much, everyone, for your hard work, for your dedication, for being here for all of us and being the unsung heroes. That's my only comment. Thank you, and God bless you, and God bless your families. And please, staying safe isn't enough to say. We need y'all. So y'all can't go down because we're dependent on you, okay? So Gayleen, Norm, y'all can't go down. I'm sorry, Stephanie. Y'all gotta stay safe because we need y'all. God bless you. Thank you. I'm done. Less than a minute.
Thank you. Thank you so much, Brian. Less than a minute indeed. Next, I'm seeing a hand from Jacqueline Muhammad. Jacqueline, are you there?
Yes, I am. How are you? And thanks again for this beautiful opportunity to learn more about what's going on in the community. I would like a question, I guess it's a question. How will you all, what kind of efforts are you putting forth to reach the people who don't have internet and Zoom and such, like people who are homeless in a sense?
Hey, Sable, can I take that real quick? Because I feel like this is a good time to do a shout out for our what we're doing tomorrow, which is our tomorrow, December 16th. Dr. Oliver will be back at it, and we are our communications team is working on a big event. It's a statewide event where it'll be televised, and we're hoping to provide this panel to talk through the vaccine and have this expert panel to talk about it. And it's being recorded and televised throughout the state.
Absolutely. Thank you so much, Dr. Whewell. That was an appropriate time. We will be taking note of questions. We're going to save the last 10 minutes or so for folks to respond to questions, but we want to hear as many comments that we have so that we can get as many in as possible to make the most of our final Q&A time right before the end. So I see that Paul Bose in the chat has a comment. Paul Bose, are you there?
Yes, I'm here. I'm a member of the Newport News NAACP, but I'm not representing the NAACP today. Gayleen, I'm so sorry about your mother. I didn't hear, nobody told me. I'm just very, very upset about that, and I'm sorry you had to go through that. As a veteran, as a teacher, as a person of color, a male, who's dealing with heart and dealing with lungs, if we have the highest probability of death, what is the state of Virginia doing to attack that statistic as it relates to getting the shots to the Black community? That's my statement in question.
And thank you, Paul. I certainly, I know that my colleagues on the line have some answers to that. I am taking notes for us to make sure that we get an answer back to that before we retire this evening. And I'll start writing up a response for the chat, but we are certainly looking to engage and make sure that our vaccine communications are tailored to especially vulnerable and marginalized communities. So before we answer your question, I'm just going to open up the open up the lines again for folks who have comments. I'm seeing Keith on the line, Keith's iPhone. If you're recognized for your comment.
Yes, good evening. Thank you so much for recognizing me, and thank you for this session. One of the things that I would want to put the question into the chat, that we recognize that information always reduces anxiety. Who delivers the information can do a lot to either increase or reduce anxiety as well. I'm the president of the Tidewater Ministers Conference, and one of the things I recognize that there are some people who often consider themselves to be brokers of information for our communities who are not. And so how are you going to identify people who will indeed be brokers for underserved and marginalized communities, those communities that often don't get this type of information?
Absolutely. I'm registering your question as how are we going to tailor our messages for particularly vulnerable and marginalized communities? Thank you so much for raising that, Keith. And once we get through the rest of our public comments, we will be sure to address that. I'm seeing Sharon Houston there. Sharon Houston, are you there?
Hi, I am. I'm Sharon with Norfolk, resident in Norfolk, Virginia. My comment is young people, the 18-25 have been known to transmit the disease. And so I'm asking how are we planning to make sure that they take the shot or get the vaccine, making sure that they are, so that they won't take it home to their grandmothers and great grandmothers who often are raising them in our communities.
Absolutely. I'm registering your question as focused, tailored messages for young people and how we can ensure that we have containment mitigation efforts for folks, for those young individuals like the Gen Zers and millennials among us to make sure that they aren't passing the virus along. Thank you, Sharon. And we'll get an answer to your question as soon as we get through the rest of the public comments. I'm seeing someone, they're registered as iPhone, but if there's somebody named iPhone who would like to make a comment, you are recognized. Is there an iPhone person there? I'm sorry.
is Catherine
I wish I
Dean.
had more information. Uh-huh.
Do you hear Catherine?
I do hear Catherine, yes.
I just wanted to, I do appreciate you all this evening with this information. I just wanted to share a little bit of something. I worked for the Carilion Health System here in the New River Valley part of Virginia. I'm a healthcare administrative associate, which is a fancy term for administrative assistant. And of course, I do have people in my, some friends that I know that are also in the healthcare system. But I wanted to share something that I put on my mother's door because I live with my mother, and we have people coming in without masks. And I got frustrated one day, a couple of days I thought about it. So I wanted to share this post that I put on the door. And it says, "We support the Virginia governor. Wear a mask. If you do not live or sleep here, wear a mask. If you did not receive your mail here, wear a mask. If you care about my physical health, wear a mask. If you are truly my friend, wear a mask. When I visit your home, I expect to wear a mask. So return your love to me and wear a mask when you enter my home." And I just wanted to share that because I had a friend come in here that works for the healthcare system that I work for, and she's closer to patients than I am, and she was not wearing a mask when she was in my home. Thank you.
And I thank you for sharing that that public comment this afternoon or this evening, excuse me. So I just wanted to make sure I'm reviewing. I'm seeing a couple more hands here. Jonna Coleman Yates, you're recognized.
Yes, as mentioned before, this has been quite helpful and informative. I wanted to more so pose a question about the engagement with local public health departments. You know, as we begin these community conversations and help to better inform our communities about the COVID-19 vaccine and the distribution and so forth, what has been done to communicate to the public health departments that organizations will be contacting them potentially to help them communicate this information in forums? So I wanted to just pose that question because that is extremely important to not only have us, you know, I'm representing my company and Delta Sigma Theta Sorority Incorporated. And I just wanted to make sure that we are keeping everyone informed, that we're not acting as the health experts, but rather we have those individuals present when we are engaging the community in our upcoming forums. So I wanted to pose that question.
Well, Delta to Delta, I'm super excited that you are here joining us this evening, but I will also register your question for us, for that to be answered. I'm going to reserve the last 10 minutes or so for us to have our panel respond to the questions that I'm notating. But for right now, if we could have, I believe, oh, there's another hand that I saw, but it looks like that hand has gone away. So just to confer, I'm just going to do a quick overview. We have about 12 minutes left in our time this evening, and there are a couple of questions that I would like for us to answer. And before we get to those, I see the hand that I was looking for. Jane Cabarrus, are you there? Jane?
Hi, Jane from the Eastern Shore, Jane Cabarrus from the Eastern Shore Community Service, wear many hats. Well, we were the last to receive the PPEs. We're the last to receive the testing, free testing sites, which we still need. And on the Eastern Shore, we have a lot of non-professional people that you're not going to find that work in the healthcare of the hospital of those places. And I'm very concerned that I don't want any of our folk that want, or are we going to encourage to get the medication or the shot to be left out? And we have a big problem over there because we're over that bridge. We're like on an island. So therefore, I'm always fighting for the people over there. And I think that we need to make some noise to make sure that we're inclusive. I don't care where you work. I mean, I know that's not the way it's set up, but like I said, we have a lot of non-professional people that really deserve this. We had a lot of people to go home and say, quarantine yourself, do this or do that. By the time they got back to the hospital, they were dead. I mean, they were almost gone because it was too late for them. And if this can help them, some of this to what we see, that's what we need on the Eastern Shore.
Thank you so much, Ms. Jane, for sharing that. And I think that it's a really incredible point to make here. So to provide us with some clarity on some of the questions that we've received and some of the comments and / questions that we've received, I just want to recap for our panelists. I know that we have Dr. Oliver, we have Director Brown, we have Dr. Underwood, we have Galen Knoyton, we have Dr. Stephanie Whewell, and any of the other issue experts that we have on the line. There are several questions that have been raised here. So I'm just going to lift them up and we can kind of respond in turn in terms of who would like to address the pieces. But one of the questions that came up was about communications. And I know that we have a specific group that is going to be working to develop specific communications materials as it relates to the COVID-19. And there were 2 communications related questions. One of them related to messengers and how we, as the state, are going to be selecting the messengers that are going to be most impactful to communicators, to communities, across the Commonwealth. And then the second question is going to be, how are we going to tailor communications for specific subpopulations? We heard an oral representation of millennials and Gen Zers, the younger demographic, but I'm also seeing some concerns in the chat about the African American community, faith-based communities, the disability community. What are we doing to tailor our communications and make sure that both the message and the messenger are right? Anyone from the panel like to address?
I can take part of it and I can turn it over to you all, but I want to say that we have a partnership subcommittee that is on the vaccine advisory committee. And this committee had developed a list of organizations from across the Commonwealth that we will look to help spread the word and disseminate information on this vaccine. And so that process that's in the process right now. The other part of the question, what was the second question?
About tailoring the message and messenger, how we are deciding those pieces.
Right. So this is the reason why we're having these listening sessions, so that we can hear from you all to start tailoring the message to make sure that we're on point and we're reaching the different demographics. And someone asked the question that we have any disability experts. We do have disability experts as on advisory committee. We have many experts. As I said earlier, there is a whole lot of people that are in all different arenas, experts in different arenas that are working on behalf of everyone in the Commonwealth. And so we should be very thankful for that. And so with this messaging, we have the SADAL group and several partners and contractors that are helping us to devise the message. But the message that definitely will be coming from you all,
The other thing, Sable K, I would just mention is that we also have the Health Equity Working Group that will be identifying those trusted messengers. And Keith, one of the things that for your question in particular, we know that interfaith, faith leaders all over our Commonwealth are those trusted leaders. And so the Health Equity Working Group has known that from the beginning, and with Dr. Oliver's leadership and the governor's leadership, really as a person of faith, we have reached out to faith leaders for our Face It VA campaign. And we will do the exact same with regard to the vaccine communications campaign. And so stay tuned. There'll be some exciting webinars coming up, and we're going to be reaching out to faith leaders all over the state, because we believe that faith leaders are a trusted messenger. It's not only about the message, but the messenger. And so I really appreciate your comment. In terms of those messages to our young people who live in intergenerational homes, we will be leveraging social media to communicate with them. We know messages to our younger audiences, they engage with TikTok and as Dr. Oliver mentioned, all those social media platforms like Instagram. Maybe less Facebook, maybe that's for us on this call, but I understand more young people are on Facebook these days. So I just say that we are tailoring our messages to the younger populations, because, and we're also doing things that particularly target our college populations and demographics, so on college campuses. So stay tuned, some exciting things coming.
Sable K, can I make a comment here?
Absolutely, Dr. Oliver.
This is Dr. Oliver. This is a mea culpa. Earlier in the evening, I said that there were no people in the clinical trials with underlying medical conditions, and that's not true. I misspoke. So please strike that from the record. Instead, pay attention to the chat box there where Dr. Furlano has entered in some extensive information about the Pfizer trials that shows that they tested the vaccine in people with chronic medical conditions, HIV, other ailments, and found that the vaccine was completely safe in those populations. So I think that it just underscores the importance of getting this vaccine to people with chronic medical conditions. We know that COVID-19 is deadly to that population, and the vaccine is at most something that will give them some minor flu-like symptoms for a day or two. So we need to protect them. Aileen, my heart goes out to you about your mom.
Absolutely. And thank you, Dr. Oliver. And just wanting to underscore for the individuals in the chat, I'm seeing some really good networking, some really amazing information sharing that's happening. In addition to receiving the link to the session, the video recording of this session, for those individuals who are sharing their information publicly in the chat to everyone, for those who are sharing resources, and also for the questions that are being posed and the resources that are being listed. All of that is being compiled by the incredible team within the Office of Health Equity, and will be sent to you all by the end of the week with the FAQ document, a link to the FAQ document, the information that has been shared publicly, and the link to this recording. So that way you all will be able to share it widely with your networks, the information to the extent that we have it for this time. We have about 2 minutes out before we get to our scheduled ending time, but I just want to raise a couple of other points, just kind of thematically looped from what was said in both the chat and both was said in the public comment. There have been some specific questions and concerns about this public-private partnership. We had conversations about faith-based entities, but there's also been concerns raised about reaching out to community-based organization, health centers, also engagement with the local health departments. So if we could have a member of our panel to discuss how some of those logistical challenges are being addressed, and how we are engaging our community partners as part one. And then part two, in terms of the tiers, I know that we had a conversation about who is going to be able to have access to the vaccine, but we have had some concerns about people who may be providing that role, but may not have the traditional like vocational experience. They may be attending to somebody who is elderly, who has a chronic condition, but how do we handle those folks who are non-professional healthcare essential workers and make sure that they have the protections that they need? So in our limited time remaining, if we could have some folks from our panel respond to those two questions.
Stephanie, I don't know if you want to take a crack at it. We have 35 health districts across the Commonwealth. Those health districts work very closely with community organizations, faith leaders, others in their local jurisdictions, and they're reaching out to them to ensure that they are involved in helping to both communicate the importance of taking the vaccine and organizing to ensure that the vaccine is administered in an equitable fashion in those communities. Sable, okay, what was that second question?
The second question is about the non-professional essential workers, home health aides, folks of that nature. Where will they be placed in the hierarchy for vaccine allocation?
We don't have a hierarchy worked out as of yet. We have a long list of the essential workers, which includes the ones that you just mentioned. We will be developing a sort of priority list, given that the amount of vaccine is still scarce at this time. And then, as Dr. Underwood said, throughout the entire COVID-19 response, we have been very, very adamant about having everything we do be done in an equitable fashion. And we will go to the Health Equity Work Group, we will go to our Vaccine Advisory Work Group, and we will present this prioritization to them and have them tell us whether or not they think this is an appropriate prioritization, so that when we actually put that out there, it will be something that will be vetted by health equity experts, ethicists, people rooted in the Black and Brown communities in the Commonwealth, and we can feel assured as a result that we'll be doing this in the most equitable way possible.
Yeah, so on the vaccine unit, we're working very closely with the Unified Command and of course, our Vaccine Advisory Work Group, and then also the Virginia Disaster Medical Advisory Committee, as we continue to make decisions and have to prioritize the vaccine as there's limited availability. We do expect that the CDC Advisory Committee on Immunization Practices, ACIP, will be meeting towards the end of this week, and they may be able to provide more information about that prioritization beyond healthcare providers and long-term care facilities. And from there, then we'll take that information and bring it back and work very closely with our within the Unified Command to further define out the next prioritization for other essential employees and critical infrastructure.
Absolutely. Thank you so much, Dr. Oliver. Thank you so much, Dr. Whewell. I know we were running just a little bit over time, but just want to provide, again, a great thank you to everybody who has taken the time out of their evenings. I know there are so many other things that you could be doing, but really appreciating you all for taking the time to raise your questions and your comments and your concerns. Also, a big thank you to our Governor, Ralph S. Northam, and to the panelists that we've had on today's conversation, to Dr. Janice Underwood, to Dr. Norman Oliver, to our Commissioner, for VDM, Curtis Brown, and also a big thank you to our OHE logistical team, Veronica Cosby and Jasmine Smith, as well as Galen Canoyton for providing remarks from the Virginia African American Advisory Board. Thank you all so much for your questions, comments, and concerns. This is but the beginning of our chat together. And before we wrap up, I just want to provide an opportunity for our panelists to share closing, this last minute remarks that you would want to impress upon folks before they depart for this evening.
Okay, if I can have just 1 minute and then I'll turn it over. I just want to, I know, I'm sure Dr. Oliver has some closing remarks. I just want to recognize one of the things that I failed to mention is that when we started our vaccine planning, which has been well underway since early this summer, one of the things that we established is the Vaccine Advisory Work Group, and we are so very fortunate to have members and co-chairs like Galen Canoyton and others. And then I want to say that specifically thank you to the Health Equity Group and under your leadership and many others. We've really been able to make these community conversations be the beginning. And I really want to emphasize that, the beginning of much more. So we appreciate such this dialogue and communication. It helps us recognize areas in which we can certainly continue to provide talking points and more information. And we want to do that. And we want to point everybody back to our website, as well as other opportunities in which we can outreach to all of the different communities. So I want to thank everyone for the time. And from there, I want to give it to Dr. Oliver and anybody else that has closing remarks.
I'll be very brief. I think it was Galen who said that the folks who are here at this community conversation are the actual leaders in the community, and I genuinely believe that that is true. You are thought leaders, you are activists in your communities, you are people providing services, very important services to the community, you're faith leaders in the community. I hope that you will take the information that you've heard tonight and get that information out as broadly as you can to the people who trust you and trust your leadership. In doing so, we will all join together to be in a successful campaign to vaccinate the residents of the Commonwealth. And I thank you in advance for all that hard work that you have been doing and will be doing as we go forward. So be safe and stay well.
Thank you, Dr. Oliver. Are there any other members of our panel who would like to provide closing remarks?
Yes, thank you, Sable. I just want to thank everyone for being on this community conversation, and want to remind that tomorrow there will be a community conversation with the disability community, and on Thursday there'll be one with the rural community. And so there were some questions in the chat about that. So this is an opportunity for you to join these community conversations and pass the word on to make sure we get more people to come on disability in the rural as well. I do want to say that when people tell you that they're over COVID, you just tell them that, you tell them this, you tell them that you might be over COVID, but COVID is not over you. So it is here until everyone gets vaccinated and we get rid of it. So let's make history together and destroy this disease. Thank you.
Thank you, Galen. Any other closing remarks? Well, thank you so much for everyone. I just really appreciate you all taking your time out. I know this has been such everyone's lives are so busy and there's so much on everyone's plate. So thank you so much for taking this opportunity to learn from us, and also for giving us an opportunity to, most importantly, learn from you as we are crafting our communications endeavors, as we are looking to craft our FAQ documents. So just wanting to let everyone know, to reiterate, I'm seeing some of the concerns in the chat. We will be sharing the recording for tonight to the extent that folks have shared their contact information. We will be sending that publicly available contact information to everyone. But most importantly, just thank you to our panel. Thank you to the participants. We are because you are, and it's going to be incredible what we can do together for our COVID vaccine operations, but also for what we've been able to do in just surviving this year together. So again, thank you to everyone. Please keep in contact with us. This is just the beginning of our conversation, and I hope that you have a good rest of your Tuesday. Good night, everyone.